The Rivers State Government has pledged full medical support for survivors of the recent gas explosion in Ngozi Odu local government area, which claimed 3 lives and left 18 injured. Deputy Governor Professor Ngozi Odu made the commitment during a visit to the Rivers State University Teaching Hospital on Wednesday to assess the condition of survivors. Professor Odu expressed deep sympathy, particularly for families grieving the loss of loved ones, and assured that the state government will provide comprehensive healthcare for the victims. The explosion, which occurred on January 4th at a gas retail outlet in a densely populated urban area, has left the community reeling. 9 of the victims were members of Jehovah's Witnesses, with 2 tragically succumbing to their injuries. Survivors are receiving intensive care at a hospital, where journalists were restricted from accessing sensitive areas.
I think that should be on Saturday towards around 2 to 3 p.m. I was in my compound, I stayed just opposite, and I had a gas explosion. And suddenly I saw fire all over the place, and so many persons were injured, who have been in the hospital taking treatment. BMA, some at the Sonabel Hospital. And thank God for the fire service that came earlier to rescue the area. Before then, we, the community, with some help of non-indigenous, we tried to fight the fire before the fire service came and also helped. And I think that's what happened that fateful day. But right now, they are in the hospital, but we are asking for River State government to come to also assist, because the bill there is much. And also, I think by this time I'm expecting the local government chairman to have been here to also, but up to now I've not seen any of them. For now, I have recorded about 20-something persons, the ones I saw, about 20-something, but I don't know if it's more than that, but for now I know it's about 20-something persons. 1 child is dead already.
It was on Saturday by 3 o'clock. So a gas cylinder, 50 kg, with feed up, burst, and secluded the whole flame of the light everywhere. So people injured, have some goose burn. The flame of the fire hit the oil burst and flew everywhere. People were admitted in the hospital. Even as at yesterday morning, the small girl of this young man here died yesterday in the hospital, and the young man is in the hospital critical. Even this my neighbor here, the sex girl was critical. The shop was burned. Everything here was burned. Everywhere we are so crowded. So I thank God for my life. I was here then, but when the thing exploded, I run inside, and that inside was the time the thing exploded. That was why I saved. That is what happened. Please let government come to our aid. We have lost so many goods and some lives, and there are so many people in the hospital lying so carelessly, nobody to treat them, nobody to take care of them. That is why I want the government to come and help us.
7 of them are still here receiving treatment. We have already lost 2, 1 on Saturday and 1 yesterday. We have all been putting in so much effort, not just on behalf of our own brothers, but all those who have been directly affected by this particular incident. We have had quite a number of support, and we are happy to continue to receive the support that we are getting.
Areas. In response to the tragedy, Odu local government chairman Chiji Okunwo has banned gas retailing operations in residential areas to prevent similar disasters.
Although we've lost 3, but the others, they've been battling and they're improving. Those that couldn't open their eyes before opening their eyes, they're beginning to talk a bit. There's some communication now, which means that the government is working so hard through the health system, from the commissioner to all of them that are working here. We want to let you know that at the end of this visitation, which the governor is aware that we're here, the Commissioner of Health will do a report to the governor. Part of it is to further support the hospital with medications and all the things they are using, supplies to take care of the burns. And also, more importantly, to also read the report and see ways that they can reduce the burden on the families that are affected. Governor would work with the health team to see what they can do. So we would not fold our hands and turn our backs to the families that are impacted negatively.